Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Well, welcome again. This is Dr. Lewerenz from Longevity Health Institute. Thank you. I am doing a first ever right now, so it's kind of nervous, a little, anxious a bit, but in a good way, because I always get excited about things I do, and this is the fun part of my job. I actually love this. Actually, everything's the fun part of my job now that I think about it, because I love helping people and bringing them cutting edge stuff. But we are doing the first ever AMA, and AMA is Ask Me Anything. So hopefully you caught some of my social media, on Instagram and Facebook, and and you sent me, I got about 40 questions. We're going to try to cut through, at least half of these and give you some good answers. I have not, I'll tell you, just looked at them briefly a second here ago. I've not studied or anything. And I'm going to try to answer these because the interesting thing is there's no ever, especially in our visits at Longevity Health Institute, my practitioners, there's no ever a bad question, a stupid question. In fact, sometimes some of what people often will think is a silly question or they feel, uneducated or not too bright is often some of the best questions. So I'm happy to, answer these. Now, in my field, obviously the 6-point model of what we do, and I think I'm going to get into this question right now. One of the first ones I actually got is a little bit about that, but we dissect for your health span, so we're dissecting your physiology to improve your quality of life. And, this is a whole episode we can do on longevity and what is longevity and, what is the biologic age clock and blah, 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 blah. Okay. I don't want to get into too much of that, but really, if we're here, let's enjoy, right? If we're here on this earth and God's let us be here, let us enjoy, let us thrive, let us not just survive, not just Band-Aid and take drugs and, not that I'm against prescriptions or pharmaceuticals. I'm a real doctor that writes real meds and does all the typical, Western medicine things. But if we can make things better, if we can hit your physiology and impact your health, so many things around that are just going to expand. And that, what I mean by that is your family, your business, people you touch, people you love, people that have, really, it's a ripple effect of quality around you. And so if you think of that, and I always talk about the 1% rule. If I'm better today, 1% that I was yesterday, think of where we'll be, in 100 days, 90 days, 3 months, 6 months, okay? And this has huge impact, on your life. So my AMA, we just threw out these questions, I don't know, maybe 3-4 days ago, and I'm just going to, plug through these, So here's a question. Thoughts on probiotics. Should everyone take them regardless of their gut health? Excellent question. Actually, I get this asked before. And, this is one of our 6-point model. What we dissect and the physiology that we dissect is it's so impactful in the body, and that is the GI system, the gut, okay, which is also your nutrients because your gut is how you absorb and what you put in your mouth, etc. So, we have trillions, okay, of unidentified and many, by the way, identified microbiota in our gut. And we also have, yeast, and we have antigens and things in our gut. In probiotics and the things that you hear about probiotics are so important because, and we're just, I think, really just unraveling this now. The gut is the second brain. I know you've heard that, and me say that, but you've heard that out there in the world for the last several years. But it really is. In fact, there's studies now that where they can dissect your stool and they can look at actually your short chain fatty acids and be 10 years ahead of and predict Parkinson. And I'm telling you, we will be way ahead of neurologic conditions in the next real short future, next few years, just by really focusing on gut health and the quality of your gut and diet, okay? And I will tell you, and you've seen this and even other guests that I've had on and talking about, so many people have bad digestion, deal with heartburn, bloating, reflux, food allergies, can't eat this, can't eat that, bowel issues, IBS, and whether they personally just treat it or see a practitioner and they're given a therapy or a Band-Aid, often it is kicking the can down the road. So now getting to this question, on probiotics, what are my thoughts? And there isn't a best probiotic. There's not one best probiotic, and there's not one best strain probiotic. And I will tell you, and you can quote me on this and bring it up in years to come, we are just scratching the surface in medicine right now, and in all forms of medicine, on the really full impact of your microbiota and of the bacteria, okay? Just came out in the last couple of years, for instance, is a probiotic called Akkermansia muciniphila that actually helps build your GLP-1 in your digestive lining, which helps satiety and helps insulin resistance, i.e. that probiotic helps reverse diabetes and slow down insulin resistance, which ultimately helps you lose weight, like the peptides, the GLP-1s on the market, like, Ozempics and, Wegovys, and so the semaglutides, tirzepatides, et cetera. So my thoughts on probiotics are, should everyone take one? Absolutely. Absolutely. And here's why. Your gut health is only as good as it was day one when you're brought into this earth, this place, okay, when you're brought into existence, and you get most of your gut flora in utero and from your mother. And then depending on whether you're breastfed, the foods you eat, the impact of, pharmaceuticals potentially in the hospital, God forbid you're antibiotic intravenously from C-section. And then what do? We go out in the world, we eat all this ultra processed food, and we have all this stress. And we, 2025, live in a really fast culture. So that stress and eating, chewing less and, excessive, like I said, ultra processed things, eating hormones, eating and consuming, antibiotics. So things that are non-organic, drinking alcohol, and, that alone is essentially almost an epidemic if you compare to, decades past of alcohol consumption. Now we're told that it's okay to, do THC, and that's a whole nother topic, but what does that do to our gut? My point here is that we start knocking down our digestive flora. We start, really beating up our guts from the day we're born. And it has such an impact. And mostly, I believe that's why we don't see a lot of digestive issues in kids and teenagers, because they have a decent epithelium, they have a decent gut lining, and they have a mostly, good gut flora. But again, it depends on their mother, depends on how they're brought into the world. Okay. So, should you take, a probiotic for gut health? I do believe you should. Do I? Absolutely. Do I forget sometimes? Do I mix it up? Do I change strains? Is there one that's particularly great? No. I usually kind of, it's like a shotgun approach. I mix it up. I have my patients, we do target and do precision probiotics in the practice when somebody has SIBO or has leaky gut or has candida or has food sensitivities by stool analysis and that. But remember, I said that's scratching the surface of your full microbiota and your full flora. But yes, I don't think you can go wrong taking a probiotic. I think it's really essential. And I put it usually in my top 2 or 3 supplements that people should be taking, because with aging, just like we age and we get attrition with aging physiologically and functionally in organs and everything, remember your digestive lining is an organ system. It will age, whether you have a symptom or not, it will age. And this is why we do leaky gut analysis, like live blood, microscopy in the office. And this is why we do stool analysis and we do food sensitivities, et cetera, because most people in the 3rd, 4th, 5th decade of life will have some non-pathologic bacteria or some imbalance in yeast and candida or some leaky gut, and taking a probiotic, as well as foods that have good probiotic and good fermentation in it, a lot of fiber and things are super, super key. So hopefully that answered that. And one of the other questions, which was on a different platform, but I want to read it exactly. In your opinion, what is the most important point of the 6-point health foundation model? I have to say, I want to tie this into that is because it is your gut. Now, that doesn't mean the other points in the physiologic system that we dissect and unravel are not important. But think about it. It's like what our grandparents and, ancestors said, you are what you eat. You actually are what you absorb. And, you can positively and negatively influence your gut flora so easily. And, we get such big impacts. And when we just address digestion, diet, whole food eating, clean food eating, organic eating, a study just came out about ultra processed food. There was literally, I believe, and this is off the top of my head because the study just came out, I think just this week. I think it was over a 15 times increase in cancer when you consumed in the top quartile in the study, the survey, who had the most ultra processed foods. So you want to prevent cancer, I will tell you, you need to eat clean and you need to have good gut health. And you want to have good energy, you need to have good gut health because that's how you absorb your amino acids and your proteins and your nutrients. You want a good immunity, you need good gut lining, okay? You want less autoimmune risk, or you want to reverse or improve your autoimmune disease, you need a good gut lining. Not just a probiotic, not just gluten-free. You need an analysis on your gut lining, your epithelium, and building that to help stabilize your immune system and your inflammatory immune response. So hopefully those go together. But yeah, so when somebody says to me in the office, they say, "Hey, doc, I love you. This seems great. I hear great stuff. This is a lot of shit to handle. Can you dumb it down?" And I will dumb it down. Usually I dumb it down and I say, let's just focus for a while on your diet and your gut health. Let's, make sure you're on the right probiotics. Let's make sure you're on the right amino acids. Let's make sure you're eating right. Your stress is down. You're sleeping good because that helps gut recovery. You're detoxifying good at night. So let's focus on gut. You're pooping, because that's how you put all the toxins, and after methylation, dump all the junk in the toilet. So let's focus on that. And I will tell you, just sometimes when I do that, people really get traction into their health and really make a big difference. And, it gets overlooked. Anybody can take a peptide or a hormone. Anybody can take a vitamin and feel better. But you're talking about true health and health span. You want to fix your gut. So that was a great question. Here's one totally just different. What are your thoughts on AirPods and the brain? And he says, I won't wear them. So it's interesting because I've done a little research on this. Not a lot, so I'm not going to sound like some expert on this, but it's the concern of obviously EMFs, the electromagnetic frequencies and what it does to our brain. So EMFs heat up our brain. That's been shown and proven. In fact, actually, there's a study I think you heard me maybe before say, but I tell my patients, the dominant hand side of the body often causes brain cancer, glioblastomas. And I don't think it's anecdotal or coincidental that, if you're right-handed, you tend to get brain cancer on the right side of your head. They've done studies on the closer, the phone is to your body and how your brain heats up and, can cause some reactive oxygen species, which is inflammatory and not good for your brain. There isn't great studies on this. There probably never will be. And the reason is because of the industry. And, I don't even believe that even if there was good evidence that we would change our habits very much. I do use intermittently, because he asked me if I would wear them, and he says he doesn't. I do use intermittently things like AirPods, earbuds, or, all these, wireless headsets. Not very often. Truthfully, it's probably only a couple days a week for maybe a half hour or hour. The research I've done is that you have way less EMF frequency than you do on your phone. So the Bluetooth to those is way less of a frequency, even though it's in your ear and by your head. I think the best answer to this is, my thought is, I think it's about, how much you use them. People business put them in their ear and on their computer and using them all day. And, I'm probably scaring my producer right now out there, but, it's, I don't think that's smart because I don't think we know, and I don't think we'll ever fully know. But I think, less is more. And, you got to enjoy life. Everything's about balance. I go out to eat and it's not organic. And I'm sure some of you out there do too, but I think about it, and so the point is, I think you just got to have awareness to this, that you are getting EMFs. I never put my phone to well, I shouldn't say never, but it's like less than 1% to my head. I always speak on speaker and, tend to, if I have to, walk into a private room in that. I don't like my phone anywhere near my head or body. I think it isn't coincidental that the incidence of head and neck cancer, not just the cause, okay, but the incidence of head and neck cancer is up 5-fold. We used to only see this and think it was related to smoking and environmental toxins. Now there's studies in association to Epstein-Barr, cytomegalovirus, HPV. But I can't ignore the fact that all of a sudden we got all these EMFs all around us, and now we're putting phones next to our heads and our upper body, and just head and neck cancer is pretty deadly. Most people don't survive. Many people don't survive more than 2 to 3 years. I had a very, very, very good friend of mine pass. He lasted about 3 years, even with very aggressive therapy. I'm a big screener for head and neck cancer, even the viruses that are associated with head and neck cancer, even HPV. Sounds kind of crazy, but I do non-conventional testing of HPV in your throat because I do believe that that's a big increased risk to head and neck cancer. But the EMF part, to get back to that, the EMF part is because it causes DNA degradation. You're damaging your DNA with EMFs. So of course you're going to get an immune infect. And if you got a virus and you're aging, you got any other environmental influences, I think that this can, turn on, your system and kind of advance, cancer, especially in the head and neck. But yeah, be careful with the EMFs. It's real. And it's why, and you guys might not like to hear me say this because it's not really popular, but I'm a huge fan of sauna. You guys see me. I'm sorry, my shirt's off. I get a little flack about that, but I just feels weird to wear your shirt in the sauna. Anyway, very sweaty, but I sauna, many times a week, mostly in the winter because of just, it feels good. But I use a traditional sauna, steam, rocks, etc. I use infrared light separately in my house and for other things. I'm not a fan yet until I see, and it's been around a long time, and I know the data on surrounding yourself with infrared light for 20, 30 minutes in a box, a heated box, because that's EMFs. So now I just gave you a question, even though I answered that question, but that's just my thoughts on that. All right, next question is, what are the most common health myths, misconceptions you hear from your patients? So here's one that I'll tell you because it's really hot the last year. Pretty irritating to me because it leads people down rabbit holes that are really, really unnecessary, and cost of dollars and anxiety, and also chasing something that is way off target without significant objective testing. And that is the myth that we have and harbor massive amounts of parasites, and they cause basically every condition. Now, are parasites real? Yes. Are parasites in our body and discovered often in our body? Yes. Do we test in our office for parasites? Yes. Do we treat parasites in our office? Yes. Do I believe in that? Yes. Okay, so I want to be really clear, okay? But there's a lot of non-licensed practitioners with very minimal experience out there, or they did a weekend certification or even a few months, and they treat everybody for parasites. You walk in there, you got parasites. And they do detoxes and cleanses and this and that, okay? And these people now then they become the condition. They now in their body and in their head, they believe, and in their psyche, that they have parasites, and that's causing whatever is discovered. By the way, and I mean, when I say myth or misconception, they believe their hypertension is from parasites. They believe their fatigue is from parasites. They believe their cancer, if it developed, is from parasites. I mean, I could go on and on and on. And the sad part is it's how things get missed. And I think it's truly malpractice. I mean, that's my personal opinion. I'm not going to be a big, I have a lot of fans with this, sometimes saying some of the stuff. And again, I said, we test, treat, identify objectively, though, appropriately. But to label all these people and every condition is related to parasites, I think is way overboard. And again, you put a patient, a human, an individual now in a space that believes that that is their condition, and then many things can be missed. Now, maybe less serious or dark, what are some other myths in that? Other myths are that no one should be on statins. Wrong. That's a big topic. I've talked about it with even cardiologists, a couple of them here on my podcast prior. Dr. Khan's been on here, very intelligent physician, and talked about, statins and their use. And I'm not a huge fan where it should be in our water and our kids should take them. I mean, I think, and I will tell you, I've had incentives sent to me, my office, for me to put statins on patients for their cholesterol, regardless of symptomology and history, but just because they have high cholesterol, that's it. So this is a huge topic, but I will tell you, statins are not the devil. They save lives. Many people need them, especially if you have known coronary artery disease, if you have plaque, if you have arthroma in your coronaries, and especially if you have any other risk factors, hypertension, diabetes, obesity, smoke, high inflammation that you can't or you're not getting down. And don't get me wrong, I don't write and I don't usually use many statins in my patients, but when needed, you have to use those. It's like you don't throw the baby out with the bathwater, okay? And, if there is a potential side effect, of a statin, most of the time it can be mitigated with, ubiquinol, CoQ10, sometimes magnesium with muscle inflammation, but the CoQ10, attrition that you get with these, which I love huge doses of those. I think it's very important. Helps. This new study came out about fatty liver. High dose CoQ10 actually can help reverse fatty liver. You do have to dose people high though with that. But seeing and having this fear of statins, yes, I think they're definitely way overused and overutilized. And you do need cholesterol for your brain and for your cells and to make hormones and, but there's a place for them. And there's a place, especially I find in men, that have cardiac disease, that have other risk factors. And, I think it is, a very, very misconceived topic, and both, there can be two truths, way overused and not a great drug for everybody, but also has a great place and very beneficial and saves lives. So I'll leave it at that. Common toxins we're exposed to daily without realizing. Another great question. There's no question your environmental toxins are, they're out there and they're everywhere. Your bisphenols, your microplastics, there's new stuff on this, how they're found in the brain and in your cardiovascular system, heavy metals, I could go on and on with this, as far as, but where you don't realize it, I think, and I think I talked about this before, or at least I mentioned it, is this says a lot is environmental toxins, period, whether we're talking, about heavy metals or just water solubles, and that they're in our environment, in our food, they're everywhere. And there's a big association in a study that came out about living within 1 mile and 4 miles of a golf course and how the incidence of Parkinson and even to some degree dementia, they're very neurotoxic. They're very carcinogenic. And I think it doesn't mean you don't go play golf. I love golf, and you don't go out and live, and you don't, but you have to have awareness of this. I think to answer the question, where is it mostly exposed? It's in our ground. So unfortunately, we're getting a lot and aren't aware of. So this is where I'm a big believer of this. And again, might not be popular for me to say this, but you got to look and we do this. We do environmental toxin testing and heavy metal testing in our practice all the time. Because if you don't look, you don't know. And I would say it is extremely rare, and I could pull out some data from our practice, but I'm going to tell you that probably 90% of our environmental toxin tests or heavy metal tests and or both are positive. It's not if you're toxic, it's how toxic. So you got to look and appreciate them, and you got to do things to mobilize them out of your body. I don't think it's so much you have to try to avoid and have anxiety and paranoia and, stress your life out about it, because it is our world. But, eat whole food, eat organic, eat free range, be smart with air and water, filtration, try to use the least amount of plastics, think of things that are, aromatic, meaning, gas offs, from carpets and plastics, just have awareness. And then this is where I'm a big fan of saunas or anything that's going to make you sweat, because you get a lot of those out of you. You detox by sweating, peeing, and pooping. So put it in the toilet, put it on your skin, take a shower. But I think that is the biggest thing is probably just what we're, eating and putting in our body. Now, the one last thing I want to say is this: if you have weight to lose, okay, the best and biggest thing you can do to actually decrease your toxic burden is weight loss, fat loss. When you lose, 5, 10, 15, 20 pounds of fat, you have enormously detoxified your body, because most fats, whether they're water soluble or not, are held in your body in fat. Most toxins, are held in your fat. So simply losing weight is one of the biggest, most efficient ways of detoxifying. Another question here is, aside from exercise, what's one non-negotiable you do every day for your health? So besides exercise, what's my one great question again. I love this. And actually this is easy. It's very easy. So you guys can probably tell out there, I am of growth mindset. I always look for improvement, even when things are wonderful. Probably makes my kids hate me because, I'm always looking to be better, and I don't rest on my laurels. But I always do mental health stuff every morning, whether it's spiritual, mental health, could be 5 minutes, by the way. It is a non-negotiable, even if I'm on vacation or something like that, whether it's a Stoic book, it's a Bible, it's a, health growth minded book, mostly those spiritual and, mindset things, positive thinking things, quotations. Currently right now, I'm doing something that I'm telling you, and I had a very positive mindset, and I had very good outlook on 95% of things in my life. We all have, tough stuff, real things, past traumas and emotional things in our life. We always do. If you don't think you do, you're lying. Go see a therapist. They'll dig it out of you. But I started doing this year in January 1, because every year I start something new. January 1 this year, 2025, I started doing a gratitude list, and I have to write at least 3 things that I can be grateful for. I try to do 3 to 5. Sometimes it goes down to 10 because I'm on a roll. And I noticed on there a lot of are my wife, my kids, related, my dogs. I love my dogs. Hi, Banksy and Louie out there. One day I'll have them on the podcast. And it really made a huge impact, even though I was in a good place and, no purpose to it other than just this will be good for me. And reading a gratitude book and, in breaking things down super simple. So my non-negotiable is I take 5 minutes, sometimes it's 20 minutes, but at least 5 minutes a day. I write down gratitude things, in my life. It can be simple, by the way, just that I can taste, that I don't piss in a bag, that I, unfortunate, when I lost my hair, I have a round head, not a lumpy head. It doesn't have to be all super deep. Now, of course, I have a lot of things on there, my children and my wife and, my family, my mom, and, things in my life that I'm grateful for, my team, my office, my family, is always on there, and, health, of course. But, sometimes I literally just that I can feel the shoes on my feet. and I don't have neuropathy, it doesn't have to be super, super deep. And it's interesting because it makes you appreciate life. But those are non-negotiables, because if I don't start my day with that kind of mindset and that kind of thing, it's easy. My phone starts going off, family stuff, bills, office, dog gets sick, things happen. Life, by the way, life's like a crown, there's ups and downs, and, it's always, shit's always coming. You just have to have the right mindset, so that helps with that. If you could tell your younger self one health tip, what would it be? So I used to believe, and this tells you how uneducated I was going into med school. And by the way, I went to University of Michigan and St. Louis University. I did graduate. And I went to a private Catholic Central, private high school, not an easy high school. But how uneducated and how unaware I was of our food industry, and you guys will laugh about this, but if I could change this, because it's so dumb, I believed that Taco Bell was healthy. I believe that if I just had the bean burrito, it was good for you, right? Like what, right? Right? Exactly. My producer out there is looking at me like, it's not? And I know they're good, by the way, the sauce, everything. Well, then somewhere in med school or after med school, I figured out what actually was in the bean burrito. By me saying, just hold the cheese, and probably got a Coke with it, by the way, at the time. I had the concept that was healthy. There were some other things I had a concept that I would change, because I was very fit. I always worked out, always played sports. I was fortunate enough to not have a lot of trauma in my family. I had a divorce in my family and stuff. But what I mean is I had a lot of love around me, and I've been very lucky in that way. And I have a lot of gratitude to that. But I would say, though, that I did some silly, what we all do when you're young, I would never eat that now. I believe that, by the way, any vegetable was good for you. I had so many vegetables in cans. But again, it's not going to kill me at the time, but it is funny that I had that concept, and, I probably wouldn't drink as much as I did in college and, high school even. That's the truth, but that's, you got to live a bit and learn a bit, and very unnecessary, but, basically had a lot of fun, Now, the other, thing I would tell you, and it is it's like a psychological health tip, is that I would have, and I tell my kids this all the time, my son, Keegan, Kaylani, and Kalia. Kalia's already 27 and already, rocking it, and great job, and going to get married and everything. But I tell my kids this all the time, because they got still some life to kind of get traction on, and all that, is I would have focused more on targets. I would have focused more on goals and worked it backwards to get there. It kind of just organically it happened, just because I was going towards medicine and education and all that. But, that's some of that's, just, maturity and wisdom with aging. But I would have embraced that a little bit more, that specific targets, and a little bit more consciously. So, one interesting thing, it just popped out here because I'm getting a good hormone question here, is how do estrogen levels, detox pathways, and inflammation relate to cancer prevention? Well, that's a loaded question, but there's a lot in that question. So how do estrogen levels and detox pathways and inflammation relate to cancer prevention? So, well, just so you know, inflammation in general in your body is the root of almost everything. So just remember that. In fact, if you really want to dumb things down, and this is dumbing it down, I'm not going to suggest that this is this easy, but like just if you tracked your CRP, your highly sensitive CRP, which is an inflammatory marker in your body, and you, whether it was weight loss, exercise, a better diet, gluten-free, losing weight, doing detoxes, less alcohol, whatever it was, and you trended that, I guarantee your health is getting better no matter what other lab's going on. So if your CRP is going, from a 10 to a 3 from a 5 to a 3 to a 2, or under 2. That's our goal, is have your, CRP under 2. In fact, I like it less than 1. But my point here is that, that's something that drives all diseases, even cancer. Okay. Now, into the question, particularly with estrogens and detox pathways, is, hormones have to be methylated, sulfonicated. They have to be, basically put through a process after they've been used that then you excrete out. And some of this is genetic and some of this is epigenetic. And the importance of this is super key because it's overlooked a lot when people use hormones and or their own innate hormones, is because, again, you don't feel it, you don't know it, you don't understand what's going on. And if you have imbalance in these levels, inappropriate levels of estrogen, particularly estrone, and I'm making it simple just because this is a huge question, but can influence prostate cancer with a man with aging and can influence ovarian and breast cancer with a female patient, again, innately and or exogenously if they're taking hormones. And so this question, I think where it comes from is, if you are doing hormone replacement, or if you've been told that you are estrogen dominant, men or women, or if you've been told that your estrogens are just quote unquote high, or if you have suspicion that your estrogens are high, okay? And I'm going to tell you out there, and I'm being very broad, many of you out there do, if you're overweight, if you drink alcohol, if you have fatty liver, and if you're perimenopausal, menopausal, or a man near andropause, or, a man 60, say, okay, you are getting estrogen dominant. Plus there's a lot of xenoestrogens in foods, okay? The only way these get balanced in your body is through detoxification through your liver. And if you're not looking at those, you do have a higher risk of breast, ovarian, prostate cancer. And that's at least what we know right now. Okay, now I'm making it simple, but I guess my point here is, if you're on hormones or you have any suspicion of excessive hormones in your body, like estrogen, which men on testosterone replacement can convert through their liver to estrogen. We don't make estrogen in our body, men. We convert it, whether it's our own through our liver or it's exogenously, a shot, a cream, a pellet, whatever. Women the same way. You have estrogens, and through your liver, they fractionate, and you can get inappropriate estrone. I want to say this because I'm very, very confident about this. I've seen it. It's studied. It's physiologic. You should not, you're going to hear me right, you should not take bioidentical oral estrogen without a good practitioner that's testing your estrogen or hormone metabolites. And the reasoning, because even though it's bioidentical, your estrogen, your estradiol and estriol, et cetera, will metabolize orally through your liver, and you could get higher levels of inappropriate estrone, which puts you at risk. Now, we do hormone replacement, thousands of women, and men, by the way, all over the country. And I want to state, though, that I'm very opposed to oral estrogens of any form, but even bioidenticals, because I often see that they convert to estrone and they put somebody at higher risk. Now, if somebody demands it, can it be watched? Can it be tested? Can you improve it with detoxification, with helping your body methylate, et cetera? Yes. But favorably, I go towards bioidentical hormones, transdermal creams, or pellets, because they have a much less tendency of that. The best thing you can do, by the way, to detoxify, and I kind of said this earlier, for your hormones, is be the appropriate weight. Make sure that you sweat plenty, whether that's a sauna, whether that's exercise, but that you saturate your shirt 3 times per week at least, and you poop. You're putting your junk every day into the toilet. That's how you. That's the first way you detoxify, is make sure that you are getting rid of your hormones that have been used. But make sure that you're sweating, and make sure that your weight is appropriate, because that keeps your hormones the most healthiest in your body. So yeah, our next question here on AMA, this one is really good. It says, "What's the best strategies to boost your immunity before a cold or flu?" So this is great because obviously we're here, kind of mid-ish August, and fall will be here, unfortunately, before we know it, and kids going back to school and bringing all their bugs to us, and it happens every year. We ramp up every September, October because of this. So probably the best thing you can do for yourself, and this is going to sound so simple, is make sure you are managing stress and you're sleeping good. Many people grind and go, and life's good, and they're juggling all these things. And that is what puts, a stressor on the immune system and leads to so many things. Now, I'm going to tell you how you can ramp up your immunity, but don't overlook just good sleep. Good sleep is how you make hormones, you detoxify. Your growth hormone is made mostly pulsatile at night, which is huge for immunity. And I will tell you, people that get sick and get sick very easily, one of the first things I ask them, besides their gut health and diet, and obviously we check nutrients and things like this, but is, hey, how's your stress and how you sleeping? I'll see this all the time. And I'll tell you, I treat athletes and entertainers, musicians. Some of the worst are mid-season or mid-tour, and I get the call to go and see him, on tour, go backstage, or I, have him come to the office because of, the season and travel. And a lot of it is because the physiologic stress burden of being up. By the way, a lot of my patients, if they're seeing me, they're not, they're not cocaine guys and staying up all night. They are literally just late nights, can't wind down, short, sleep sessions, and then, other stressors. But the point here is that they aren't getting enough recovery, and athletes the same thing, and that stresses the immune system. It's an adrenal effect, okay? But how do we ramp up the immune system to, cold and flu season? One of the biggest things is just optimize going into the fall, not in the fall, going into the fall, is your vitamin D. Make sure your vitamin D is over 60 deciliters, I think per ml or per liter, I think that is in the testing, but it's 60. The cutoff for normal, quote unquote, okay, which is not optimal. Remember, we want to be medicine 3.0, not 1.0, is you want a vitamin D above 60 for a strong immunity, okay? But, you could take a little extra zinc. You can take extra vitamin C. You could take some quercetin. You can take a probiotic, okay? Those are all really, really key. I'm a big fan. In our office, we have a product called D-Hist, and it has quercetin in it, nettle, some zinc, a little bit of vitamin C. But that concoction not only is an immune boost, and I believe that's from a company called Orthomolecular. Don't quote me, but I think that's from Orthomolecular, a great pharmaceutical company. But D-Hist, does not just symptomatically help sinuses and allergies in your immune system, but it is an immune boost. Now, I'm also a huge fan of, and this gets a little bit of, kind of side-eye looks sometime, but water-soluble, small nanoparticle silver, okay, that again is water-soluble, so it's nanoparticle silver. It's hydrolyzed. You do not store it in your body, okay? And it's not colloidal, if you will, in that sense where it's traps and you're going to turn blue. But silver is very antiviral and very antibacterial, and using it as a nasal spray or a throat gargle, etc., doesn't disrupt our natural microbiome, and can really, if you get ahead of it enough, can really knock out a cough, a cold, or whatever. We used it a lot during COVID or trying to prevent COVID. I think it did a really good job for me in the office and even traveling the first year and a half of COVID, really limited. I didn't get sick at all till it hit me once a big time, but it did steer clear of a lot of stuff. But the biggest thing, like I said, remember is, the D, the zinc, the C, the quercetin, but is sleep. And not, if you're stressed and you're going into the fall, I'd recommend go see somebody. And the reason is, somebody physiologic going to look at you, set goals, do functional medicine, do what we do at Longevity Health Institute. The reason is because, you won't get sick. And if we build, this is more long-term, if you build your gut health long-term, you're not going to build your gut health in 2 weeks going into the fall and expect not getting sick. But if you build your gut health, you will reverse allergies and asthma, and you will reverse chronic coughs and colds and things like this. But that can sometimes take 6 months to a year. But those are simple things you can do. People often ask me ivermectin in the flu season or fall winter season. We use ivermectin as an antiviral, but that's not something preventative. So I had a great question that was shot in here. This was earlier today. What is the best approach once you're through perimenopause? So, it's going to be looking at, even if it's just not getting practitioner, quarterback good guidance, you definitely make sure you're eating well, whole food, plant-based, a lot of fiber, high protein. Okay. And, also exercising, keeping your weight down. Women, because I'm particularly talking and answering this about perimenopause or just recent postmenopause. Women tend not to be sweaters. Make sure you're sweating, saturating your shirt 3 times a week, or sauning 3 times a week. There's a reduction in breast cancer. I don't think, and I see in my practice when I ask and interview people, many of them work out, quote unquote, lift weights and go to the gym. They don't sweat much. You need to sweat to get rid of toxins, to make a true metabolic effect in your body, besides just the cardiovascular system. And then from a supplemental standpoint, I mean, this is kind of, broad question. So it's hard to kind of, give an exact supplement answer because we're precision medicine. We're very personalized. So this is more broad, but everybody needs likely some vitamin D. Probably if there's one supplement out there that everybody likely needs and should be on, but it needs to be tested, is optimizing your vitamin D. Most people are not optimal. They're either insufficient or fully deficient. I see that all the time. And then a woman, just to make sure she's doing things that help her detoxify and help her gut health. I think that's really key. Now, menopause, or it's really called andropause for us. But I like menopause. It's kind of like the man purse, or the MERS, like a Seinfeld episode. But no, the menopause, and andropause are big things because it's really not just a full deficiency in testosterone. It's a decline in your androgen hormones, including DHEA, the inappropriate imbalance in estrogen to testosterone ratio. So your testosterone still could be 400 or 500 total, which isn't that bad, but your estrogens and your estradiol have more than doubled. So that ratio is off, which can make us moody, give us man boobs, give us soft in the middle, and low libido, hard to gain muscle, easier to gain fat. And estrogens, and this is men too, it's not just women in their cycles and all that. Estrogens make us hungry. Estrogens make us want chocolate and night food and, all the cravings and stuff. Okay. So getting that balanced is super key. I always recommend, regardless of your opinion, see a practitioner and get your hormones tested at many ages. Even if you're great and don't want hormone replacement, but just so you have the knowledge in each decade. So 30, 40, 50, 60, compare to your symptoms and also compare where you're at hormonally, because they have such metabolic impact. You don't want the big causes of death, like cardiovascular disease and cancer and immune deficiency. And then later in life, which is very common, being frail, falls, brittle, breaking bones, having poor balance. You got to address these hormones. You cannot ignore hormones and say, well, I want to be natural. Well, when you say that, that's great. And by the way, God bless you. But I think if you think of yourself decades out, you got to do that and picture yourself where you want to be in your 7th, even 8th, maybe even 9th decade. Picture yourself. I doubt it's frail in a hospital bed with your family feeding you and helping you go to the bathroom and wipe your ass. If you're lucky, by the way, that you have loved ones that will do that for you. That's what it looks like a lot if you don't get ahead of these hormones. And the reason is because they have huge, huge structural components that you can't just, you got to go into your 6th decade, your 5th, 6th decade, maintaining and building muscle and bone, because it keeps brain volume and it keeps balance and it keeps us young. And if you want to thrive, it's not just about longevity and how long you can live. It's about having quality of life and being, able to run around with your grandkids when you're 75, 80. And I did say run around because that can happen. Or you're like my beautiful, lucky, fortunate 84-year-old mother who still works out, 84, drives herself, goes to this, goes to that. We're golfing tomorrow, I hope, unless she stiffs me. Still gets off the tee box, which is awesome. I tell her once in a while because she gets tired, just throw the ball up on the green. But the point here is you got to go in there strong, intentional, and with good mass and hormones. That doesn't happen with low hormones. Okay. I will tell you. And hopefully that answered that question. And here's the other thing too, because it says, and I got to this AP that wrote this or asked this, because he put in here stress with family, relationships, balance, etc. I will tell you, before you ever get a divorce and before you ever, go see a lawyer, talk to a therapist or whatever, okay, the first thing is go get your hormones tested. And the reason I say that is because they'll make you, if they're imbalanced and if they're inappropriate in any way, and by the way, this is all hormones, so I'm not just talking about sex hormones, thyroid, I'm talking about, adrenal hormones, etc., is you'll be moody. You could be grumpy, moody, irritable, especially at night, short with your spouse, negative, and ruminate, all these things that are not, no way would anybody sign up for, and you are completely blind to them. So when you talk about relationships with aging, you cannot ignore hormones. And I just really encourage you, and I really feel powerful about that because I've seen in my office, by the way, and I've seen in my office people on hormone replacement from another place done inappropriately. So they were not the couple's edgy, fighting and all that stuff. So I'm not talking about everybody needs high dose optimal, bodybuilder hormones. I'm talking about physiologic optimal levels, balanced, okay, in a precise way. It's very important in relationships. So, all right, next, let's see here we got here. Between exercise, diet, and genetics, where's the most bang for the buck? Well, if we're talking about bang for the buck, 100%, I got to say, again, thinking of the financial part, okay, the most bang for the buck is exercise, hands down. Why? Anybody can exercise. You don't need a gym. You don't need a bunch of equipment. I know we do that and we use that, but many of us have stairs in our house. Many of us have bicycles. Many of us just whatever. You can walk down the driveway or a neighborhood and create movement. You don't need weights even to do body weighted, exercises, to do push-ups, to do pull-ups. So when you're talking bang for the buck, I think that's the best way is you can't overlook exercise ever. There is by the way, I got to say this because I see it in the office often. It's usually a man, usually a businessman, not picking on you guys, but there is no substitute for exercise. So because you're on hormones and because, Dr. Lewerenz or, another practitioner or anybody else gave you some supplements that replaces physiologic movement. And I'm not saying you have to be a stud athlete, but a few days a week, you got to move, you got to get steps in, you got to stress your muscle, you got to build muscle, like I said, going to your 5th, 6th, 7th decade to maintain it, to help your metabolic rate, to help your weight and all that stuff. Because again, the 4 horsemen are coming and those are death. And that's, cancer, heart disease, immune issues, stroke and neurodegenerative stuff. These are coming. We're not going to avoid them. What we want to do is prolong them and have great health span. And there's no way you're going to get there without movement and without exercise. So that's your biggest bang for the buck. What else we got here? Besides regular phlebotomies, is there any other way to decrease ferritin, which is your iron store in your liver, specifically decreasing ferritin without having hemoglobin drop too low? So you probably heard me talk about this. You can build up, even in a epigenetic turn-on of a gene that causes hemochromatosis, which is iron excess in the blood. We need iron to maintain hemoglobin, iron to carry oxygen in your body. But to answer the question, we order therapeutic phlebotomies, very common in medicine, not just at our practice, is because when you draw off blood, you will pull and you mobilize iron out of the liver. You just have to test the levels. So nobody in our practice gets anemic, and it's a clinical judgment. You have to test the lab after you've done a phlebotomy. Most people, if you're needing it to reduce chronic hemochromatosis, might be 2 to 3 months, every 2 to 3 months. Often people in my practice under medical guidance and precision medicine, you might only need 2 or 3 because we got them losing weight. We're starting to reverse fatty liver. They're not storing and holding them as much iron, so it's not a permanent thing. But I want to stress that it is so powerful. If there's one thing out there for men to do, not that women don't need it, but men are more common, is if there's one thing you can do for your cardiac health, is check a ferritin load. Have your doctor make sure you draw an iron and a ferritin. Look at liver enzymes. Do not ignore them, okay, even if they're borderline. And the reason is because studies have shown, small studies, and so even if we're just going to say it's anecdotal, but I mean, physiologically, this makes sense, is that if people that donate blood twice a year have over an 80% reduction in heart attack and stroke. The reason is you move actually stem cells out of your bone marrow, you make new blood, your blood becomes less viscous, so it's more slippery, becomes less sticky in your vessels, and then you reduce if you have that excessive iron burden in your body, which is common in men, okay? And we need iron, don't get me wrong, but you don't want excess amounts. Now, I'm going to take this break right now to thank our sponsor, Longevity Health Institute. Longevity Health Institute is my practice. I am the chief medical officer there, and I have many practitioners, wonderful practitioners, and I'm the lead physician there. Dr. Ryan Abood is another physician in our practice. We do a direct pay concierge model to give you time, give you precision, personalized attention, really, really deep dive into your health span and think of you years and decades out. But I want to thank, Longevity Health Institute for paying for these segments, paying for me to be on here. And, come see us. We're in southeastern Michigan. I do have patients out of state that fly in and out, and, I see them a couple times a year. Most of our patients are locally, in southeastern Michigan. But in the practice of precision, personalized medicine, functional medicine, you thrive, and it impacts your life immensely. Do not accept chronic disease as a death sentence or as a lifelong sentence. Just look deeper, look physiologic, look further, something like Longevity Health Institute. The next question here, on my AMA here is something that's interesting because it's asking about one of our systems, about our structural pain system. And they asked here, what would you recommend be the most effective for exercise-related discomfort in their back and hips? Would it be acupuncture, physical therapy, and or chiropractic care, if any of these? And then they put a little comment in here. They get a lot of this with running and any type of stair climbing. Tough question because, again, I don't know you. Obviously, you should have an X-ray, might even need an MRI. I don't know the significance and severity. So obviously see a healthcare provider that's going to get an objective test on your hips and back. You could have disc issues. You could have cartilage damage. You could have a tear, things like that. But if we're going to talk about you have physiologic functional stuff, so there's no major structural stuff done, I'm going to give you a surprise answer here. If this is chronic and you're running or you're very active, is you have to check, and it's one of the 6-point model, is your hormones. And because inflammation commonly comes from hormone deficiency, DHEA, cortisol, believe it or not, I even see it sometimes, estrogen, testosterone in a man, growth hormone, any insufficient or deficiency in these can cause inflammatory responses easier. So that's one thing. 2 is you get a lot of inflammatory responses in the body from gut health. Okay. We fix your gut, your inflammation goes down. Now something like a hip or a joint isn't hurting as much. Okay. Even if you have a arthritic condition. As far as what you're asking, I always start usually with physical. So if we address those, I always start with physical therapy. Even when I use peptides like the wonderful peptide BPC 157, that's a regenerative peptide for recovery and healing of many soft tissue and ligamentous things. It's very anti-inflammatory, that and TB 500, but I use BPC way more, and it's been out for a while. Been using our practice about 5 to 7 years actually, and BPC is wonderful. I'll start there, but even in there, I'll often have somebody use physical therapy with it, because imbalances happen. If you're a runner or a biker, there's sometimes some imbalances that happen that need to be addressed, and that could be part of the issue. Using a peptide like that, by the way, and that's just one, there's others that can be used. Sometimes even I'll have them locally inject it. We'll show them, teach them in the office, or they'll come in the office. And then they, ask about chiropractic care and acupuncture. I like them all, okay? I just usually start with physical therapy, get objective results so we know fully what we're dealing with. I love to make sure that the systems are right physiologically, so you have the least amount of inflammation in your body. And then, chiropractic care would probably be the last for something like hip, to be honest with you. That's just my opinion. Not that they're, and that's a whole discussion out there, because there's great chiropractors and there's ones that'll just, they'll line you up and go for months and just send you a bill. And tell you should hurt more before you're better, and it's making you worse. I've seen that many times. But there's also great chiropractors that know what they're doing and know how to stay in their lane and do great work. But also, I love acupuncture because, one, there's not much of a downside. You usually get a result if it's going to help. If it's going to help, you usually get a result within 1 or 2 sessions to some degree. But again, I like to start with physical therapy after objective testing and documentation of what really is going on. And then I got time here on this AMA for one more question. And actually, this is a really good one because it's really hot right now. What is the pros and cons and benefits and some of the negative that are going on with the GLP-1s? And what can you do to prevent the side effects? So, this is a huge topic, great question, but is that these GLP-1s, by the way, are life-saving, life-changing. Anytime you can reduce blood sugar and diabetes and reduce fatty liver and, cause weight loss, there's a win-win-win. Remember, some of the biggest longevity studies that make a hugest impact are on blood sugar control, and that's through metformin. And I will tell you that this is in that realm. It should be done in a very precise way, personalized way, microdosed way. There is not a one-size-fits-all. The way it works is they help insulin sensitivity in the body, so you become less insulin resistant. You also have more satiety. You don't eat as much. You also do not have as much motility in the gut, so you have to be a little careful with bowel issues. But again, the best way to use these, and I'm very for them, just done coached right in a very precision way, personalized way. There's no one size fits all. We use a scale to measure muscle, bone, fat, water, etc. You need to maintain muscle, eat enough protein, have enough amino acids, make sure you're absorbing them. And if it's done right, these can reverse many chronic conditions. And it's why studies have shown 30-40% reduction in cardiac events, 30-40% in stroke events. There's studies already that are showing improvements, not reversal, but improvements in dementia, because sugar rots the brain and creates a lot of neuroinflammation. So these are amazing. It's just they have to be done right and understand physiologically how they're working. I personally would use one. I don't, never have. But if I needed, if I saw my A1C or my fructosamine, one of my average blood sugar type of measurements, creep up, okay? So the minute it starts creeping up, I'll probably go to that microdosed versus metformin to help my health span and extend my life, my quality of life. Hopefully that's never, or it's in my 70s or 80s. But my point is I'm very comfortable with those. It's just that you have to maintain muscle. And with eating less, you're not going to potentially get as much protein. And also by having less bowel motility and gallbladder bile release, you're not going to absorb your proteins and fats as much. So you either need to take bile acids, ox bile, you need to take digestive enzymes with your protein and fat so that you absorb them. But just if you address those things, it's a win-win-win. But I will tell you, you can't go on a GLP-1 and feel better and, think things are great. In fact, actually our producer here, I'm not going to call out his name, but he shared with me not long ago a story about his friend that actually, by going on the GLP-1, he actually reversed he thinks, or at least his symptomatically wise, his asthma. And the reason is, you lose 20, 30 pounds pushing on your diaphragm, your breathing's going to be a lot better. You're eating healthier because you're eating less. Okay. So your gut, health is getting better. The one thing I also stress with this is I love to put people on, and you heard me earlier in this segment on this AMA, you heard me mention a probiotic called Akkermansia muciniphila. That probiotic will build GLP-1 in your gut. It may take months, to be honest with you, but I like to synergistically use Akkermansia muciniphila with the GLP-1s, with these peptides, because you're getting then, when you go off this injection, you have this natural GLP-1 build in your gut lining, and you're very likely to keep that weight down and have insulin sensitivity much, much better. And so it's easier to get off these shots, okay? But I will tell you my experience so far throughout the years, one of the biggest impacts that maintain the weight and that people don't reverse and, gain the weight back or feel horrible or have any, issues are people that are exercising on it and building muscle. And what are the biggest muscle groups in your body? Guys, I hate to break it. It's not your bicep. Okay. That's for the chicks and for your wife to enjoy. Okay. It's your quads, it's your legs, and it's your glutes. You want a flat belly, build your ass. Okay. You have to lift heavy weights, even if it's twice a week. You have to lift heavy weights twice a week on your lower body, build that muscle. And that's the most important part of your body with aging is your lower body. Your lower body mass correlates to longevity, and there's many reasons for that. But yeah, that's the most important thing. And I think just most people, they have to, unless they are aware of it and really focus on it, getting in, it might be 90 grams, depending on your body weight, might be 100, depending on I just saw an NFL guy, just retired NFL guy. I mean, normally I wouldn't coach somebody to have this much protein, but he, he's got to get about 150 grams of protein in a day. And to maintain his mass, he was a big guy, real big guy. And, he'll do it, but, that's going to take a lot of intention. And, otherwise he's going to be skinny, but skinny fat, and he's going to lose that mass and his metabolic rate's really going to drop. Now, since I'm on this topic, and I said it really briefly, but I love new science. So just published in Nature, July 2025, a scientific journal. And I love this. So this week, I already started bumping up everybody's CoQ10. So CoQ10 is a antioxidant in the body. And it's not fully understood where we all get it and how we produce it, but it's very critical in redox reduction reactions. So these reactions that have a lot to do with energy and kind of mitochondrial fuel, okay? And the higher the level of CoQ10 in this study, people mobilized fat out of their liver, and it started to reverse fatty liver. And I'll tell you, part of your metabolic rate is in your liver. We don't think about that. But if you're fat, that means you have fatty liver. And you don't even have to be that fat to have fatty liver. Fatty liver, thank God, is reversible. But if you have anything you can do to mobilize fat out of your liver, and by the way, a side effect of this is you stimulate your mitochondrial fuels with CoQ10, you'll have energy. So you'll feel better. You'll have better, kind of daily energy. And I'll tell you the dosing that this was studied on, and it should be watched by, a practitioner, okay? But you will then change your metabolic rate. So it's not just you're losing weight and losing fat out of your liver, but now you've influxed your metabolic rate, okay, in your body permanently. So you're burning more calories, just like if you gained muscle, you're burning more calories per minute than you were prior, okay? Now, usually the doses are pretty high. You know, the study was in a 20-day span, getting about 20 milligrams per kilogram every other day. But bottom line is you're going to probably need about 600 to 800 milligrams of CoQ10 to make a difference. I'd split it up. Obviously, I wouldn't take it at bedtime. You know, and this is not me directing you. Obviously, you can test your CoQ10 levels. You can retest them. We do CoQ10 injections in our office, just like NAD injections, et cetera. But this is actually really exciting. And it's interesting because it physiologically makes sense, because it actually helps reverse, reaction oxygen species, which actually helps mitochondrial inflammation go down. And so you're basically helping your liver mitochondria, okay? And anytime you do that kind of stuff, real good things can happen. I mean, that's why NAD is great. You stimulate your mitochondria with, nutrients, CoQ10, NAD, methylene blue is one of the cofactors in the mitochondria. You've heard about the benefits of that. My point is, all of a sudden, you are going to really, really get some good health results. Just make sure, obviously, it's a supplement. This is not medical guidance to you out there. This is always talk to your doctor, your provider. But this is really exciting because I think that might be coming in the future. And it's already out, but what I'm saying, it might be coming in even further studies, and I wouldn't be surprised if this was used, because we have an epidemic in America of fatty liver. So listen, I'm going to wrap it up. This episode 32, this AMA, my first AMA, Ask Me Anything, this Q&A. Hopefully you guys got a lot of wealth of knowledge out of it. Please share it. Please subscribe to my podcast, my Instagram, my Facebook, because, it's in my heart, my passion to really share this wealth of knowledge and the experience with my patients. Because even my patients teach me. I want you to know that. This is not just all up here or in my readings. The patients obviously educate me a lot too with the experience. But share this with others, share this with loved ones, share it with somebody you don't like. I don't know, bless them. But it'll really make an impact on the world. We are making America healthy again. I love that. We're ripe for it. And if we're going to be here, why don't we thrive? So be well out there. I'll see you on the next Deep Six podcast. And, we're happy to help you always at Longevity Health Institute. We got practitioners actually waiting for you. If you need help out there, we have patients, from all over the country, mostly here in southeastern Michigan. But, we'll see anybody, any ages, because we really like to make an impact. Plus, I always remember it's never too late. It's never too late to make a health impact. I have 70-year-olds, 80-year-olds come to us that we make big changes and make them happy. And in their later years of life, even they start thriving and enjoying life better. So be well and enjoy yourself. I'll see you on the next Deep Six podcast.